Welcome to the Academy of General Dentistry podcast series featuring Dr. George Schmidt. Each episode features experts in the field of dentistry who share insights and inspiration to help you succeed. Let's get started.
Hey, welcome back, everyone. We have another great show for you today as we come to you from the brand new AGD's podcast studio right here in sunny South Florida. Before we begin, make sure you subscribe to our channel and hit that like button and ring that bell. That way, you'll be among the first to be notified of all things AGD. Today, my guest is Dr. Parul Dua Makkar. Hey, Parul, how are you?
I'm great. Hi, George. And thank you so much for inviting me today.
Oh, thanks for coming on. We're really looking forward to this conversation over the next hour. Let me tell our audience a little bit about you before we start here. So Dr. Parul Dua Makkar's life took a different trajectory when she lost her only and younger sibling, Dr. Manu Dua, to oral cancer. He was a dentist as well. Following his death, Parul devoted her time to educating doctors and patients about risk factors, prevention, and early detection and treatment of oral cancer. Parul is a frequent contributor to publications both in dentistry and beyond. She also co-authors healthcare journal articles. Posthumously, Parul co-authored her brother's book, Life Interrupted, Dr. Dua's Survival Guide, which won a CIPA EVVY award for motivational and inspirational books. Parul practices general dentistry in her Long Island, New York practice. Speaking to audiences across the nation, she shares her experience and knowledge while guiding audiences in developing their understanding, skills, and preventative solutions. Well, there's so many things that we can talk about here, but I think we really need to start with talking a little bit about your brother and his story, because I know that's the inspiration behind all of what you do today and all of your mission. So tell us a little bit about that.
Sure. So Manu was almost 7.5 years younger than me, and he followed my footsteps into dentistry. I graduated from University of Oklahoma in 2003, and he graduated from high school. So that should kind of tell you how far apart we are. And, the way our life trajectory was, we lived in different parts of the world at different times. I left for college when he was 10. So dentistry was the one thing that united us. We took courses together. We went to DR to place implants. And that brought us, got us a common ground. We were in different life journeys, in the sense he started his practice and I waited to have my kids and then start my own practice. So he guided me with that. And in 2019, he showed me a lesion on the lateral border of his tongue, and it was like a chewed up lesion. And he's like, "Hey, Didi." Didi means older sister in my language. And he's like, "What do you think this is?" I'm like, let me ask my surgeon. He lived in Calgary, which is on the other side of New York. And I said, well, let me see what it is. I'm going to send it to his surgeons. And I did. And they flat out said it's oral cancer. And for your audiences, Manu was healthy, played every sport you could think of, couldn't beat him on squash. He played rugby, badminton. And he was healthy, non-smoker, occasional drinker, family history of cancer, but not oral. And he was just shy of his 33rd birthday when he told me about this. And he's like, you know what? I'm getting this treated. I'm getting prednisone, and never had a biopsy, which is an immunocompressant. And for a month, he was on prednisone, never had a biopsy. He's like, you know what? They think it's my wisdom teeth. So after he turned 33, got his wisdom teeth pulled out. That didn't resolve the lesion. Finally had the biopsy. And when I saw him in July, I travel every summer to Canada, and I'm like, Manu, stick out your tongue at me. And it was this brown, leathery, ulcerated lesion on half his tongue, very different than what he showed me. I looked at him like, like a kid brother, like, are you kidding me right now? Why haven't we biopsied this? He's like, I was waiting for you to leave. I didn't want to biopsy it. We went out for sushi. He's like, I can't eat sushi. It hurts. I'm having earache, unilateral earache, all those classic oral cancer signs. Finally, he was biopsied with a stage 2 squamous cell carcinoma of the tongue with nodular involvement in his neck, and needed, in August of 2019, needed a hemiglossectomy, graft from his left arm as well as his thigh. It was an 8-hour inclusive of many different specialties, surgery in August of that year, in 2019.
Wow. I mean, there's so many things here that I think are important, right? And I think first and foremost is it doesn't sound like you had any risk factors or very, very few risk factors, maybe some alcohol. And I think a lot of times practitioners may say, hey, you know what? Yeah, this person's healthy, they're young, and so on and so forth, and we're not really screening for these things, and we should be. And I think that's a really important thing to point out here. And the other thing is, coming from a man, is that a lot of times, especially men, we let things go. We're like, that's nothing, and this is not something I have to worry about. But that's not the case here.
Right. And denial, it's kind of like a protection, right? If I don't know about it, if I don't do the biopsy, I won't have to deal with it.
Exactly.
And he was single. He was not married and with kids, so he didn't have a nagging wife like, "Hey, you can't eat sushi with me. Let's get that thing checked out," you know? So there were many factors, and he was high on life. I mean, he had paid off his student loans. He was started a practice that he started in 16. He was building it, and he was just he had bought a house. He was just like, "I can't have cancer. This can't be cancer." And you're right, it didn't have the risk factors. And I think the dynamics of cancer is not that older gentleman who's been smoking and drinking all his life, or a pipe smoker. It is the trend, are more and more cases of these young 20, 30-year-olds with no risk factors, but having, whether it's genetics, whether it is environmental, but there is a disposition for young people to have cancer. And so recognizing the signs, symptoms, doing those screenings, being aware of your body, it's all key, critical in saving the life.
Yeah, and all of those things I want to talk to you about in a few minutes. We're going to talk quite a bit about risk factors and screening and what we should be doing. And also, on the flip side of that, sometimes we ignore things as human beings, as practitioners and things like that. Maybe not as practitioners, but it's sometimes a very, very difficult conversation to have with a patient when you have to give them that kind of news. And I think, in the back of some people's mind, you want to just pretend it's not happening. Um, and that doesn't serve us well.
No, absolutely not. And, we would be bad doctors and dentists if we don't tell our patient, if we cannot, when you have a broken tooth and you tell the patient, hey, your tooth's dying, we need to do a root canal, we need an extraction, you need to do a filling, if we're okay to say that, why can't we not have that other conversation? Hey, you have a lesion that hasn't been resolved. Let's get a biopsy, because you can't really treat it. And that's the one thing, like I tell everyone, what's the cost of doing a biopsy? Maybe your insurance doesn't cover it. It costs you a couple of $100, an extra visit. Um, but the price of losing somebody, because these cancers spread so quickly, and they, especially if they've gone into the lymphatic system, they're going to spread, metastasize to different parts of the body. Manu's metastasized all the way to his pelvic bone within a year. And
Wow.
so from the tongue. So think how fast it spreads. And so, do that biopsy. Tell your patients, like, hey, I see this. We live in a world of technology. Take a picture, show it to them, blow it up, just like you would, like, hey, your tooth's cracked, we need a cap on it to prevent it from fracturing. Hey, we've got this lesion, it hasn't healed. I know it doesn't hurt you, or maybe it's painful. It hasn't resolved. Let's get that biopsy. I'll send you to my favorite surgeon. I'll do it myself, whatever it is. And let's treat it appropriately.
Yeah. I have some statistics here, and something like 1 in 60 men and 1 in 140 women will develop, oral cavity or oral pharyngeal cancers. And I think it's also really important to point out that early detection, and we're going to talk about that, early detection in these cases can raise the survival rate from about 50% to 80%, if I'm not mistaken. And so that's a staggering amount for us to be able to get in there and really, find these cases and get these people the proper treatment. So when you talk about, you just spoke a little bit about, a little bit of the verbiage about how you would approach a patient. Is that how you do it? I mean, what's the best way, that walk us through, if you would, if you have to tell a patient they have, oral cancer? I mean, how do you give us
First,
some words?
I never tell them they have cancer, unless it's blatant. But I will say them, like, look, I see something that's of concern. We've been monitoring for a period of time. I do, the problem is you cannot tell a patient that they have cancer unless you have a biopsy. Only a biopsy will truly determine, especially if you're catching the lesion early on. It may be carcinoma in situ. It may be just dysplasia. And dysplasias. And all these leukoplakia, 80% of the time will come out as nothing, as benign. And that may deter you. But there is that 20% chance that it is going to be a stage 1 or, cancer. And when you diagnose them at stage 1, stage 2, that's when your survival rate's at that 80%. So, and you tell the patient, just be honest, and hopefully there's a sense of trust and rapport with this patient. It's not a new patient and you've been seeing them and you're like, hey, you smoke and you have these conditions, or you're vaping. Vaping is a big problem, especially in our young teens. It's more socially acceptable. Cannabis use is another one. So there are risk factors to it. And so you talk to them and you just be honest, like, hey, I'm talking to you out of concern. You have certain risk factors. You are immunocompromised. Maybe they're diabetic, they have heart issues, and listen, this thing doesn't look so great. And if they ask you, is it cancer? You answer no. Let's get a biopsy. We'll have you see the surgeon. Let's get the report, and then we'll go from there. Unfortunately, you cannot diagnose something without getting that scalpel biopsy in.
Yeah. So are you, we'll talk maybe a little bit more about the entire screening process coming up, but in these cases, when you see a lesion like that, are you having the patient come back in 2 weeks to see if there's any change, or are you going right to the biopsy right away?
Depends on the case by case. If it is, say, they're like, oh yeah, I got a new flip, or I had this patient who was a young kid and he got a new retainer, and you could see classic, on the floor of the mouth, which is one of the high areas to get oral cancer. You see these white stray, and I'm like, what's going on? He's like, oh yeah, I just got a new appliance. So we had him not use it for 2 weeks and brought him in, and it was clear. Patient has, if you see something that could be a cause, broken filling, an appliance, then I usually have to adjust it and then have them come back and see if it resolves. If not, then yes, we do a biopsy. But if somebody's like, they've come to me and they're like, yeah, I've noticed it in the past. How long have you noticed for? I don't know. It's been there for a minute. And does it hurt? No. Okay. Then I might push to get it quicker because they themselves have noticed about it. So it just depends on case to case, how well I know the patient, what kind of history, medical, and so forth, and how the lesion presents. So.
Yeah. So again, we'll talk a little bit more about that in a few minutes. But, one of the things, excuse me, that became of all this was that your brother was writing a book, I guess, and you helped him finish that book. And it's called, and I mentioned it in our opening, but it's called uh, Life Interrupted, Dr. Dua's Survival Guide. And I know it's just a couple of things that you talk about in there. Appreciate the power of hope and how it could sustain us through hardship, and appreciate the hand that life dealt and discover how to make the best of it, explore techniques to inner peace, and so many other really inspirational and helpful things that your brother left us with. So tell me a little bit about that book. And I think we can get that on Amazon, right? As well.
You can, absolutely, or on my website. Yes, it's on Amazon or Barnes and Noble, any bookstore. But when Manu had cancer in 2019, his cancer returned in April of 2020. That's when COVID hit and borders were shut down, US and Canada. I wasn't able to go, and he needed another surgery, chemoradiation. They had seen a chest lesion. Fast forward to the summer, he's like, you know what? I'm going through chemoradiation. He turned 34, and he said, I'm going to quit dentistry. He wasn't quite happy, and with the surgeries, and definitely COVID played a role. And also, he had numbness in his left arm where the graft was taken from, mental fogginess. Patients who have gone through chemoradiation will attest to that. So he's like, I'm just going to quit. And he sold his practice. And because he was single and socially isolated, because a lot of the treatments was in isolation, friends couldn't come as, regularly. Canada is very strict. And so he decided to turn, and he was getting weaker with the treatment. He decided to write. That was his outlet. And he talked to me. I met him in December of 2020, and he showed me all his work. and he was barely walking and talking at this point. He had a chest poured in, there was fluid buildup in his lungs, it was all over his lung lining. He was deemed inoperable. Death was this thing that was knocking on our door, and I just chose to ignore it. I didn't want to answer it. And he's like, I really want to be published. I'm like, all right, this is what drives you. Keep going. Let's do this. And I found him a publisher in February, and he said, no, I want to keep writing. I said, go for it. Unfortunately, he passed away very suddenly. He went to the hospital on a Friday. Saturday, he was moved to hospice. And my parents said, you need to get on a plane. And this was when PCR testing required 3 days. I'm frantically. And Sunday, actually, I said goodbye to him, just like you and I are talking. He was on a morphine drip, body was shutting down. And I told him, if you need to go, it's okay. And I think sometimes when a person is in that stage, they almost need that permission to let go. And within hours of that conversation, he was no more. So I knew flying in, I was going for a funeral. And it's happened to me twice after that. Another time after that, I lost my dad very suddenly this past November. And I walked into his house and everything was the same. Unfortunately, he had also told me about this article he was writing for Dental Town, which is in the book, and that was on his in the mail. The article, the book, and everything was the same. But birds are chirping. Medication that he needed was still stayed there. Dirty dishes because he went emergency into the hospital, and things that needed to be eaten he was saving for when he got better. And his life was interrupted. Everything else stayed the same. Unfortunately, world doesn't stop for you to process what's actually happening. It just keeps going. And he called it his survival guide, and that's where the name Life Interrupted Dr. Dua Survival Guide came from. And when I sat in his room in his house and I looked at his computer, which I'm using right now, I felt failed as a sister. I couldn't save my younger brother as my job. Failed as a dentist. I couldn't get him the earlier diagnosis. As a daughter, I couldn't help my parents while he was undergoing this treatment, and I wasn't there when he passed. I couldn't do anything. The one thing that I could do was put his words out into the world. And I wrote the epilogue to tell the world he was more than just the cancer that took him. And he had made peace with his fate. He was very comfortable. He did not at any point say, this sucks, my life, this woe is me, why did me, what did I do? Never. There was no blame in not getting diagnosed earlier. He had accepted the fate that had been presented to him. And he's like, I'm just going to leave the world a better place. Whether I found my peace, I'm okay with not participating in the world. I'm no longer allowed to do so. It's okay. But I've learned my lessons. I'm not a failure. I've learned from them. That doesn't define me. And we're all mortal. We're all going to die. To accept that mortality and to create something powerful to leave behind. And that's how we create our legacy.
Yeah, what an incredibly powerful, emotional, and sad story that you're sharing with us. And it must have been so incredibly difficult, not being able to travel. It was during the pandemic, and oh my gosh, my heart goes out to you.
Yes, it's, time, distance, circumstances. There is no handbook in that. And nobody to tell you, guide you, because like many people during COVID, it was unprecedented times in our profession, in our lives. And I consider myself lucky that I was able to attend his funeral. I know there are
Yeah.
people who didn't have that opportunity and that closure that you need sometimes.
Yeah, well, he left us with a wonderful and inspirational book, and I can't wait to read it. I haven't read it yet, but I'm going to certainly go out and buy it. You can get that on Amazon. One of the other things that came out of that was that you actually, from your experiences with your brother and other things, have become a grief coach. And I think you have a second book that's available, Healing the Healers, which I think is an incredible sort of addition or follow up to what we just talked about.
Healing the Healer is actually a grief coaching program, but I am coming out a couple of other books on grief. I'm writing a chapter co-authoring. But Healing the Healers came from the concept that I found myself very, dentistry is an isolating profession to begin with, and top it off with having to deal with grief in the midst of COVID. It was a very challenging time, and I found myself not being able to show up the next day, or needing extra time. A lot of anxiety of what tomorrow would bring. A lot of people would have that during this dark stage, but through my healing and through my grieving, and I found that it doesn't need to be traveled alone, and having a guide to go through, then that's came the concept of grief coaching and Healing the Healer. It's like, when your car breaks down and let's say you had a flat tire, you can either stay in that spot and be like, oh, this world is horrible. I had to go over that nail and now I've had a flat tire and this is absolutely tragedy. I'm just going to have to be stuck in this place. Or you can say, you know what, I'm going to call 911, I'm going to call AAA, I'm going to call a family friend to fix it. Or you can fix it yourself and you learn how to work the jack and change the tire. And so it's doesn't matter. Life will throw you a whole bunch of loopholes, and that's just the journey of life. It's unpredictable, it's messy, it's how you choose to react with it and what you do with it. And same thing with losing Manu. Yes, it was horrible. I never would have expected that life would transpire as it did, but I can choose to go after that dentist and that oral surgeon who misdiagnosed and go sue him. But what would that accomplish? Nothing. It's reliving old wounds. But if I talk about oral cancer, bring that awareness, bring the awareness of that we are flawed, that we live in a flawed world, that it's okay to make the mistake, but what we can do and improve and screen people, learn about your bodies, and work with other healthcare professionals and change the narrative. Let it not be another death of a young person by cancer with no risk factors, but rather like, hey, we made an awareness. Now we know what it is, that why we need to be vigilant on everybody and not just the alcoholic and the smoker, but on everyone, because cancer has no bar. It doesn't discriminate.
Yeah. Well, thank you for, excuse me, thank you for writing that. And I know we can get that on your website, and we'll direct people to that at the end. But I also know that you do so many other things to promote cancer awareness. And one of those things is that on April 24th at 7 p.m. Eastern time, you're going to be giving a webinar for the AGD Oral Cancer Foundation. And that's sponsored by Dentist Advantage. And the CE credit is going to be given from the Pennsylvania Academy of General Dentistry. So we thank them for their support. And this is called Early Diagnosis, the Key to Prevention and Conservative Treatment of Oral Cancer. And I think that's going to be a tremendous webinar. So folks can look that up. And I'm sure you're going to talk about, risk factors and all these other different things, right?
Absolutely. Yeah. Thank you for having and for the support. Absolutely. And I will highlight how cancer is more than just rushing it off to a biopsy. There's a comprehensive approach to oral cancer.
Yeah. So that's good stuff. So let's back up a little bit. Let's talk a little bit about risk factors. So we know the obvious risk factors, smoking and alcohol, but tell me some of the other things that we should be on the lookout with our patients. And this may be a review for a lot of our listeners, but hey, it's always good to review these kind of things. It's really, really important.
Sure. Of course, poor nutrition plays a factor. Having prior cancer, certain cancers can metastasize to the jaw. 50% like lung cancer, breast cancer in women can metastasize to the lower jaw. So those are additional. Another risk factor we may not think with oral cancer is being out in the sun. So if you have patients who are golfers, who are construction workers, who are lawnmower guys, those people who are out in the sun need to, just like you would do, sunscreen, you protect your lips with a lip balm because you can get basal cell carcinomas. So anything from the lip back is oral cancer. It's our field. So those are, some of them. And then the other one that has gained the why it has become more prevalent is the human papilloma virus, which is the HPV. Oral cancer is the 6th most common cancer worldwide, and HPV is the most sexually transmitted disease worldwide. It's not your STDs, it's HPV. And it's, and this is something that I will kind of go into when I do the webinar, how we can work with other medical professionals and where HPV plays a role.
So what's the current guidelines for the HPV vaccination?
So right now it's approved from anywhere from 9 to 40s. Ideally, you want to get vaccinated when your teen, preteen becomes sexually active, 9 to 11 range is when even because kissing can also cause the infection. And so ideally you want before it protects any new vaccination, any new um, occurrences. So if you've had HPV already, so it's an older person, if you're in your 30s, and you've already, it won't protect you from anything before that. It's any new infections it will protect you from. So ideally, and it doesn't require a booster, it's a 2-dose or a 3-dose, depending on what age you get it. And that's it. And you're protected.
Yeah. Great advice. You just talked about working with other professionals. So, what kind of referral network should we have? We should have a referral network. Each dentist should have people that they can turn to and refer, other than maybe even the oral surgeon. So talk to me about that.
Well, we obviously are ENTs if we're dealing with sleep, or we're dealing with cardiac cardiologists with talking to them but in terms of oral cancer, interestingly enough, you could even connect with OBGYNs. Why? Because OBGYNs are screening with pap smears for cervical cancers, which is caused by the same virus that causes oral cancer. So if a patient of theirs is positive, well, they can connect with their partner, like, hey, you're at risk for oral cancer because of the HPV. That's a guidance, and also helping with the pediatricians to promote HPV vaccines in their young. I know my pediatrician's up a wall against getting vaccinated for anything, really. So sometimes it's a hard conversation, but it could be a good collaboration to talk to, at your local library or with your pediatrician at their office, and talking about the importance of it in regards to, yes, childhood caries is there and why you need to go to the dentist, but also get the vaccination so you can protect your teen and young adult.
Yeah, that's so important. And what about so from a screening standpoint, as you mentioned earlier, right? We should be screening every patient regardless of age, correct?
Gender, anything. Yep.
Yeah.
So screening is honestly, it doesn't take that long. You don't need a fancy appliance. Yes, all the appliances, like all the other adjuncts, can help you. There's Valscope, there is, cameras are great because you can take pictures. So any of these tools, there are salivary tests, but again, nothing is FDA approved to diagnose oral cancer besides a scalpel biopsy. And that's kind of the point. Yes, these tools help you determine that something looks funny if maybe your eye doesn't see it, and those the lights will help you, but they're all just screening tools. Really, we work great with our hands. We can detect when we're going down a root canal. You can feel it, right? You've learned this is your tactile sense, and that's all you really need. But you need to have the patient sitting up, you need to be palpating and checking for nodes, you need to have them stick their tongues out, because a lot of the oral and oropharyngeal cancer in the posterior area are hard to detect. And this is where having a relationship with an ENT is great, because if you see something in the posterior region of the mouth, you can say, hey, let's go in for a scope. Are you having trouble swallowing? Are you having these other signs and symptoms? So that's where it all kind of pulls in. And train your staff too. Your hygienist should be also looking out for it. We may spend 5 minutes with them, but they're talking to them. They're having a conversation. They're in their chair for a lot longer. Your assistant's taking an X-ray. They're like, oh yeah, they came in for pain. It's an emergency. But you know what? There's something funny looking on the roof of their mouth. Train your staff as well. It all goes hand in hand. And your front desk to be, when they're scheduling that appointment with the oral surgeon, they're talking scared to the front desk, like, oh my God, do you know the surgeon? Do you think they'll be good? Should I be worried? So it's a lot to do with not only screening, but having your entire staff be aware of what we're doing.
I am so glad you brought that up because we had Susan Cotton on the
Ah,
program
yes.
a few months back. I'm sure you know Susan, right?
That's,
And that's her mission. She's a hygienist, but her
yep.
mission is to, get the team on board and, get everybody trained. And yeah, really, I was going to mention that. I was going to actually mention that to you. So yeah, so that's really good stuff. And so where can we get your book and how can we get a hold of you? Talk to us a little bit about that. Give us your
Sure.
contact information and all that good stuff.
So I'm in LinkedIn with my name, Parul Dua Makkar. I do have an online course called the Do a Good Job, and that's the website they can find me on oral cancer and on grief coaching. So I think grief is such a lonely journey, and it doesn't have to be. And just know that I have walked those terrible days, and you can kind of become out stronger and better. And so, yes, so do a good job. And on same thing on Instagram, DUA, good job.
Yeah. And so just to back up real quick, I did want to mention that I think the take home message of what you just said was that we've got all these tools, we have Velscope and all these different kind of things, and then there's visual. But if your intuition, if your gut tells you that might not be right, you really need to go for the biopsy, right? And just make sure.
Yes. And, don't tell a patient it is. You may know for sure it is unless you have a report. And you can tell them that this is what it is, what stage it's at. Let's get you to a cancer surgeon. Not all our surgeons, I've had this conversations with surgeons. That's not one of their most fun things to do a biopsy. And some of them will return the patient back. Man, that's nothing to worry about. No, it's just geographic tongue. And let's not. So really find a surgeon that knows oral cancer and that knows the urgency for it and work with them. We're not in a profession that we can just be in our own little bubble. We work in tangent with not only other um, dental specialties, but also other medical professionals and our team. And we only can do this if we're in a community and we're together and we're stronger than being in isolation and pretending that you know everything and you don't. So it's a collaborative effort.
Yeah. Pearl, we're out of time. But I look forward to your webinar that you're going to be giving on in mid-April, end of April there, where I'm sure you're going to talk a lot more about all these things. Some great information is going to be had there. I think we're all looking forward to that. So for the folks that want to look into that, you can go onto the agdfoundation.org's website, and you can find out how you might want to sign up for that. Pearl, I want to end with a quote from your brother's book to honor him because I think he's so inspirational and such a story that resonates among so many people. And he said, and this is from Manu, "Our lives will come and go, but our ideas will remain immortal. Therefore, in essence, the soul behind our work remains eternal. So seek not to fear your own mortality, but rather embrace the challenge to create something that will outlive your fears and wildest imaginations, such that you may be able to provide service years after you have dearly departed." And I think his work and his words and what you've done for him is certainly carrying that through. So thank you so much for coming on the program.
Thank you. It's truly an honor.
Yes, yes. And I'd also like to thank our producer, Kristen Gover. If you like what you heard, please like and subscribe to our channel. You can always find us on YouTube, the AGD app, SoundCloud, and Apple Podcast. If you have any questions, concerns, comments, suggestions, you can contact us at news@agd.org. Thanks again, and we'll see you next time.